expect that to be available early next week. So you will be able to access the slides, any of the links in the slides. You will have access to that. No worries about needing to scramble to jot anything down. Additionally, we wanted to just let everyone know that information is current as of today's date, as of the date of this webinar. So we are going to spend a good portion of this webinar on questions, so please do submit any of your questions in, submit them to all panelists, that way our great panels can all see them. You can submit them at any point throughout the presentation, and we will address them on the second half of the presentation today. Okay, and with that, we are going to get started. All right. So just a quick overview of what we're going to be doing here today. We're going to go through a brief review to sort of level set around some standards for access, and then we will open it up so each of the plan panelists will give a brief presentation, and then we will open it up to questions. We'll start with a few common questions, and then we'll take any of the questions that you all submitted when you registered or that you submit now during the chat. All right, so we wanted to just start by going through the access and availability standards. So these are, as required by New York State, the expectation across all of your plans for providing care. So the expectation by New York State for emergency or urgent care, if it's an emergency walk-in, you're expected to help that client get access immediately. If it's crisis intervention, you've got within 1 hour. If it's urgent care, which will be a lot of the different services that providers are on with today, for a lot of those services at least, it will be within 24 hours of the request. So this includes mental health, outpatient, substance use outpatient, PROS, OTP. It includes OLPs, CPSD, and FPSS for GSTSS. It includes also children's HCBS, specifically adaptive and assistive equipment, and accessibility modifications. So for those, if there's an urgent care need from the client, the expectation is that the provider would be able to provide access within 24 hours. Now, if it's routine or non-urgent, it depends on the service. So if you are providing CSTSS, specifically PSR, or if you're providing a good number of the children's HCBS services that you can see on the screen, the expectation is that access would be within 5 business days. Now, it's within a week if you are a mental health or SUT outpatient clinic, if you're providing a majority of CSTSS, if you're providing planned respite as part of children's HCBS, or if you're providing peer support services as part of adult HCBS. So the expectation is for those is within 1 week of the request for routine or non-urgent care. So for certain other services where it might be more specialized, there's within 2 weeks for routine or non-urgent care. So this would include PROS, the majority of the adult HCBS services, and the majority of the children's HCBS services. And you can see them listed out here. Finally, for some behavioral health specialists, this would include CBT, intensive psychiatric rehab. It's within 2 to 4 weeks from the request for routine or non-urgent care. All right, so these that we've discussed are for, again, we started with urgent and then we went to routine. There are some quicker access requirements if the client is being discharged from a hospital or residential services or a detention center. And you can find all of this information within your contract with your Medicaid managed care plans. You will have full access to any of the details of that as well as in these slides. The other 2 things to emphasize are just 24-hour access via phone to providers, and that clients shouldn't be in the waiting room if they have an appointment for more than an hour waiting. So these are the general as required by New York State expectations around access to services. All right, so now we wanted to just take a minute to remind everyone about the matrix tool that we have. Since we are focusing today on communication, and this is a great tool for communication since it has all of the contact information for all of the plans that provide Medicaid managed care. So I am going to share my screen. I'll take just a second. All right, so if you are not familiar with our matrix, You can find it on our website under, I'm just trying to share that. All right, and just doesn't look like it's sharing. Give me 1 second. Oh, there we go. Okay, so there was a little bit of delay. Sorry about that. But if you are not familiar with our matrix, one of the ways you can find it is by going to our website. So this is our website, ctechny.org, by going under Tools, and you'll see it right there. One of the first tools that's highlighted. You can also go directly to the website, and I will put this into the chat in a few minutes, and you will have access to it as well in the slides, but it's matrix.ctechny.org. There's a few different ways that you can search for plan information. You can select a region. You can select the county, or if you're looking for a specific plan that you contract with, you can select them here. So if you are looking, and for example, you hit Tug Hill Seaway, actually, I think it's doing a little delay, so let's just wait for that to open. All right, so when that opens, what you'll see is a selection of any of the plans in that region. And you'll see different tabs for each of them for the different types of areas of contact. So there'll be general, there'll be children, there'll be contracting, credentialing, and this is a one-stop shop where you can see any of the information for the contacts to figure out who to get in touch with to talk about your problem. So you see here, and if we hit Affinity, you can see the different tabs and all of the different information for contacts is there. Okay. All right, so that is our matrix. Okay. All right, so the last thing before we turn it over to our plan panelists is that we just wanted to remind everyone, we know that we are currently still in the state of a pandemic, and a lot of providers are providing telehealth, and there's a lot of questions about the future of telehealth. So we just wanted to remind everyone about the OMH, OASIS, and DOH presentation that was done at the end of June to discuss the extension of the behavioral health emergency provisions. And so you can access that on our website. You can find it in the link, but you can find it on our website right now if you don't want to wait on the calendar for June 25th. And this talks through the OMH and OASIS waivers that were created in order to allow the continuation of telehealth, much as it has been provided during the pandemic, because we are still in a state of pandemic. So you can see all of the information about that, about continuing telehealth, much the same way that you've been doing it throughout this pandemic, and getting reimbursed. So those are continuing. Of course, when this pandemic is fully considered over, when we're in a fully normal time period, there will be different regulations, and so we will all, plans, providers, clients alike, will of course be adhering to the state and the federal regulations for telehealth moving forward once those come out, once the emergency period is officially fully over. And the state has said that they will try to make sure that there is a nice period of time before it ends where they're letting everyone know what will be the new status quo. That way we all have time to adjust. And with that, I'm going to turn it over to Cheryl from Beacon Health.
Thank you so much. It's nice to be here with all of you today. I'm sure most of you know who Beacon is, so I won't go into too many details on exactly who we are, but please know that we are here to answer your questions and help in any way possible. If you can go to the next slide, Caitlin. So we just wanted to let you know how to communicate with us regarding your changes, any updates to your demographic information. So for solo and group practitioners, you can certainly visit our website. Make sure that if you update your information through the website and you're also registered on CAQH, that you are updating that information with CAQH. If you update it just through our website and don't update it and attest to your information on CAQH, then when we do our downloads from CAQH, your information will revert back to whatever is actually on CAQH. And again, that's if you're registered on CAQH. And one thing I wanted to note about your demographic information, that does also include your office hours, whether or not you're accepting new patients, et cetera. And so if you do have a change in your office hours, if you're adding hours for evenings and weekends, that would be fantastic. But if you're shortening your hours, maybe not open every day of the week, Monday through Friday, or not available on the weekends, you can also update that information. And also whether or not you're accepting new patients. We do see a trend lately where a lot of, not a lot, but, members might call a provider and they state that they're not accepting new patients, and we don't have that information. So there really is nothing worse than a member or a referring provider getting a list of providers from our website only to call for an appointment and find out that you're not accepting new patients. So if you are full for certain modalities or your entire practice is full and not accepting patients, please notify us and we will put you in a practice full status, at least for 90 days until you're open again. And then for facilities, facilities can also visit the website and make some changes to their demographic information. You can update things like phone numbers, rosters, et cetera, via the portal or our website. The thing that you can't do is update service locations because, of course, your service location may need to be credentialed. And also the service that you're adding may require additional contracting. So you would need to contact our National Provider Service Line for that, and they can certainly assist you in any further requests regarding credentialing or contracting. So we can go ahead and go to the next slide. And this is our communication resources. Of course, we have our website. This is where you would find the Beacon portal. You could sign into the portal. It has billing tools, provider manual, plan-specific information, clinical resources, and any updated urgent information we're trying to pass along to the providers. Our National Provider Service Line is open Monday through Friday from 8 a.m. to 8 p.m. So you would contact the NPSL for routine non-urgent items such as claims, credentialing, change of address, et cetera. And when I say credentialing, that's, if you had submitted a credentialing application through our portal, you can also check the status of it through our portal. But if you need to, you can certainly call our National Provider Service Line to check that status as well. I've included the provider relations for upstate and downstate. And when I say upstate and downstate, I mean the location of the provider. So if you have questions that need to be escalated, for example, a delay in credentialing related questions, claims related questions that you feel really need to be escalated, you don't feel you're getting an answer on, certainly send your email to either one of those email boxes. And also we have our EDI for portal questions and concerns. Please feel free to contact our EDI help desk. Also, if you have questions regarding claim submissions, even claim submissions from your clearinghouse to Beacon, you can also contact our EDI help desk. You can also give that information to your clearinghouse and they can contact the EDI help desk as well. And again, I just did this slide for escalations. So if you are speaking with a staff member regarding a claim, for example, you can certainly ask to escalate that issue within our customer service department, either to a team leader or a supervisor. If there appears to be a systemic issue or something that you may have tried multiple times to get assistance with, but you're not able to, Again, I put our upstate and downstate provider relations email addresses there. We don't normally put these on our typical webinar slides, but I just wanted to do it special for you guys. So if you do need to contact us, our information is there. Feel free to use that for anything that you feel needs to be escalated. And our next slide. So this is our clinical programming and support. The clinical program really takes a holistic approach to supporting members through its exploration of using in-network providers, community supports, and natural supports. We look to meet the member where the member is, where they're at, and support transitions from one setting to another. If the member is not the identified target for engagement, for example, it could be family, it could be a health home provider, etc., then we'll work directly with the appropriate entity. We strive to have collaborative relationships with our health plan partners to ensure that all comorbid medical conditions are being treated simultaneously with the appropriate case management team taking the lead in engagement and interaction. On the next slide. The next slide is access and availability. And again, we really want you to notify Beacon when you have members who are on a waiting list. Beacon would want to know how many members are on the waiting list, for which services they're on the waiting list, and for how long each member will have to wait for services. If your facility is full for one or more services, you must notify Beacon. Advise which services or modalities you are full for. If your facility is full for all services, again, please notify Beacon that you're no longer accepting new patient referrals. We can again put you in practice full status for up to 3 months, and then you would either have to start accepting new patients again or disenroll from the network. For those items above, again, you can contact provider relations. We will update your file or help you update your file, put you in practice full status if we need to. And we can also engage our clinical department if that's necessary as well. And then for any OMH and OASIS licensed facility, just to note that you must have the ability to treat a member in person at a physical location if a member requests it. In-person versus telehealth should be member driven with determination of medical necessity and any social distancing, mask wearing parameters put in place by the provider, of course. If there is current availability to see a member via telehealth but not in person, please let us know how long on the wait list a patient would need to be for an in-person visit. In any of the cases above, if the wait time exceeds the standards that we talked about earlier, that Caitlin mentioned earlier, please contact Beacon for a referral, and we can help you find an available provider or facility to render those services to that member. That's the end of our slides for Beacon, and I'll give it back to Caitlin.
Thank you so much, Cheryl and Beacon. And I will now turn it over to Empire Blue Cross Blue Shield and Lonnie.
Hi, everyone. Hope you're having a good afternoon. Hopefully there are a lot of familiar faces out there and nice to speak with everyone. Let the slide progress. Next slide, please. I may have a pause on my side. I may pull up the slides over here.
It looks like there's a delay.
Yeah, so I'm going to pull up the slides on my other screen. And oh, there we go.
Okay.
All right, so there is a little delay, so we'll get started with that. But just really wanted to kind of go over some of the information today, kind of going over contact information, escalation process, and if there are any questions, making sure that everyone can get to the right individual. But I did want to list just here on the first slide some of our provider services lines. Anytime that you have questions for eligibility, claims information, interpreter services, pharmacy, case management, call these numbers here, and there's a fax number as well. You know, we all mentioned about reporting changes in practice status and updating provider information. So we do have the email address there for when you would like to do that. Also, the website is posted. And then our practice profile update form is listed there as well that you can fax or submit electronically. Just really want to make sure that we can kind of log what's going on within the network and reflect that in our systems, whether it be in our provider directory or accessing services. So just really want to kind of, you know, discuss how important it is to update information changes for the group. And I have been following along in the chat, so I know there are some questions going on about contacts and questions, and really sounds like there's some areas that could be escalated, and this is a good segue into these slides. I know I listed 3 different areas here of how to really kind of escalate certain situations that you may have and try to get answers to your questions. The first 2 contacts that I've listed are the provider relations area, and that's Dawn Brand, who's the director of provider relations, and she also works with the contracting and credentialing. And then there's a new name here whose name is Kara Kuhn, and Kara actually works on our provider solutions side. So actually she's on the provider experience side. So if there are questions about claims, if you have general inquiries that need to be answered or requested, her team will actually take care of that. So kind of divvying up the differences between contracting with Dawn and then the provider experience with Kara's team. One person that I know a lot of people are familiar with is Marge Stuckel, and she's our government relations contact. I've listed her email address as well as her phone number here. I know that she attends a lot of the roundtables and a lot of the meetings within the state, and she's always a good contact for anyone that may need questions regarding to the plan, or if there's a way to get different contacts within the plan. Marge is definitely the person to go there as well. And then finally on here, I put Amanda Hyder, which I know a lot of individuals are familiar with. Amanda, she actually is on my team that works with claims resolution, really kind of navigating the system for the providers, ensuring that you can get to the right individual, or if your questions aren't being answered, make sure that you can kind of get a response. And then kind of also I put myself down there. I know a lot of providers have my phone number and my email address. Feel free to always email me if you have questions, or if you feel like you're not getting to the place that you need to be. I can definitely be a catalyst to get things going if you're encountering any type of difficulties. So, you know, for you, Stephen, if there are issues that you're having, please feel free, email me directly, and I can kind of get us a conference call going for those issues that you've kind of placed in the chat box. You know, I definitely want to make sure that we answer all questions, and typically turnaround times on calls or emails is around 48 hours. If you're not getting a response at all, then that's something you could escalate up to me or to Dawn or Kara to kind of help out with that. Looks like I'm getting a prompt to the next slide, so I'll go ahead and kind of talk about our clinical roles. And what I've kind of done here is broken out by teams what we have. And we have a children's team that's specific to children's HCBS. And then we also have a children's team for foster care. And really it's kind of working with UM and HCBS and foster care members to really kind of work specifically with that membership and not cross over into any of the adult services. They may do handoffs if someone were to age into the adult services, but we have a team directly associated with all the children's services. We also have case management teams that work with members and family if there are consents granted, and we really try to link members to resources that complement treatment and kind of, you know, add to traditional outpatient care. And they can also at times, you know, visit people in hospitals or in other levels of care during other times. Right now, we're not doing any of that. We also have a HARP team that works closely with our HARP members. You know, we work with health homes, inpatient, outpatient, CMAs. We also kind of work with the physical health side to make sure that everything's syncing up on that, you know, with different teams. And then we always have our utilization management team, which deals with our inpatient and outpatient services. We do have a separate manager for each of those teams. And I think a lot of the providers are familiar with our UN teams if they have questions about authorization, if it's going to try to get an act authorization, you know, that's Martha Ruff. I'm going to contact her. All these great contacts are listed on the MCTAC matrix. So make sure you visit that if you have specific questions about HARP, case management, and we're loading up the information for the children's team as well. So these individuals are all listed on the matrix. We can go to the next slide. And, you know, we were kind of asked about translation assistance and wait list. We do help providers get translation services if they don't have those in-house. We know that there can be an add-on code for translation services. And, you know, the wait list has always been kind of a discussion about, you know, who's accepting individuals, who's not accepting individuals, and really kind of keeping that current. I know that there have been wait lists for different services, and I think part of utilizing our teams, our case management, is trying to access services that somebody can get into for the short term until they could get into the other level of care or desired services that there may be a wait list. So with that being said, like I said, nice hopefully talking to some of you soon. And if you have any questions, please feel free to outreach to me. Thank you.
Thank you so much, Lonnie and Empire Blue Cross Blue Shield. Now we're going to turn it over to HealthFirst and Ashley.
Okay, there we go. Can you guys hear me well?
Yes, we can, Ashley.
Awesome. I just want to say thank you to everyone. I see a few names I recognize in the chat box already, so it's great to hear from you. As Caitlin has mentioned, my name is Ashley Solis Sotomayor. I am representing HealthFirst today. Next slide, please. We'll just wait for the little delay. All right, so the first thing we're going to touch on is communicating with HealthFirst. So one of our priorities here at HealthFirst is ensuring that our providers do have a contact, and that primary contact person is going to be your dedicated account manager. And so this is who you're going to communicate with on contact for your contact information. This is also who you're going to communicate your changes with. So that includes your service hours, after hours contacts, things like that. This is also someone who you will touch base with in terms of like wait lists and also your general clinical questions regarding care management, workflows, processes, and the submissions of documents. And so I say all this to say that if you do not know who your dedicated account manager, we do have a point of contact for you. His name is Maurice White. He is our Behavioral Health Network team lead. Next slide, please. Great. So as I mentioned, we do have dedicated account managers, and they are assigned by the servicing county or their geography. So for example, we have Maurice White, who manages some of the Brooklyn providers. You have myself, who is managing the Bronx, Staten Island, Westchester, and the Mid-Hudson region. You also have my colleagues, Anthony Ogaldez, who's managing Manhattan. You have David Singh, who's managing Queens and the Mid-Hudson Valley. And then you also have Yesenia Amores Clemente, who's managing Nassau and Suffolk. Next slide, please. So the next two names that I'm going to mention might ring some bells for you guys, but I want to touch base on communicating with HealthFirst in terms of escalation. So in the event you have any questions or concerns regarding government-related questions and state guidance, we also have David Zembrowski and Kaylina Colon. If you are ever in need of communicating with us regarding care management questions, we have three forms of contact. So you have your mainstream Medicaid, and we have an email address listed on the screen. For our HARP Medicaid, we have a HARP call-in line, so there's a phone number listed for your convenience. And then we have two email addresses that you can utilize. And lastly, for Children's Medicaid, we have two additional email addresses that we prefer you to use. Next slide, please. So the next slide is going to talk about care management. Let's just wait for it to clear on the screen. Alrighty, so our care managers are here to provide some oversight and coordination of the members' overall care, and that's in collaboration with the outpatient, inpatient, and community-based providers. Now, I know telehealth is a hot topic, and we do encourage providers to utilize those telehealth capabilities, but we also want you to keep in mind that when leveraging these telehealth capabilities, it's to reduce those barriers to care, such as the transportation, child care, scheduling issues, and things of that nature. Next slide. And lastly, I want to leave you with 3 additional resources. And the first is going to be our provider resource page. You can visit the hfproviders.org webpage. And this is where you're going to find any provider alerts, any COVID-19 updates. This is where we house our general claims and billing information, and you'll also find your provider manual. The next is the HealthFirst provider portal. So this is where you're going to be able to check a member's eligibility, view their claims. You can also view the status of your authorizations and submit authorization requests. And you'll also be able to submit your claims appeals there as well. And lastly is your dedicated account manager. So we are here to initiate the, to provide your initial orientation. We're also here to help with credentialing and contracting, any general claims and billing questions that you have or any issues, we can help resolve them. And then lastly, get you trained on how to use the online authorization tool, especially if you're an agency who utilizes authorization. This is a great tool to get your authorizations into us rather than calling in or using a fax line. I'm going to send it back over to Caitlin. This concludes the resources from HealthFirst. Again, I thank you all so much.
Thank you so much, Ashley and HealthFirst. And now we're going to turn it over to United Healthcare and Ilana.
Hi, good afternoon, everyone. My name is Ilana Adler. I am the government liaison for New York at United Healthcare. And I want to start off by saying that we are all stakeholders. And despite coming at it from different lenses, we want the same thing, for information to flow more easily between the provider and the health plan. And I also want to say thank you for bringing this issue to MCTAC's attention, and thank you to MCTAC for convening all of us here today. We really do appreciate this opportunity. All of us on this panel not only work for a healthcare company, but we have health insurance and have to navigate challenging communication systems. So we all volunteer to be part of this panel because we absolutely know what it's like to be on the other side and just want to reach a live person or hear back from someone. So just a quick comment to say we get it and we want to be part of the solution today and moving forward. And so with that, I'll just jump right into the presentation. I think with all our health plans, the members really at the center of the work that we do on the Medicaid managed care side, from provider relations to behavioral health and physical health, our quality management initiatives and utilization management as well. And what you might not know is that there are clinicians staffing almost all those areas, including LCSWs, LMHCs, and people with extensive inpatient and outpatient behavioral health experience, helping to manage the members' care and work with our network providers. Next slide. So who does what? So at United Healthcare, our network managers serve a dual function. They oversee our network and they act in a provider relations role. So what does that mean for you? The network manager assigned to the territory where your program operates really is your main point of contact. That's a person who you're gonna contact when you've got a contract related question or issue, whether you're adding or removing a service. For example, let's say you were recently licensed by OMH for crisis residential services. That is the person that you wanna contact to update your contract and add that service. Updating contact information, changing an address or adding a location, changing the regions that you serve, hours of operations, the addition of telehealth, any kind of wait list. That is your front door to relaying that information to the health plan. It's also who you're going to contact if you've got claims related questions or concerns. So I have a little bit of a luxury of being the last managed care organization to go, and so I got to see a lot of the chats. And I wanted to provide this resource for escalated claims issues. And that's Heidi Hopkins. She's our claims liaison, and her contact information is right there on this slide. Again, you don't have to quickly take a snapshot or write it down. It will be posted on MCTAC, but her information is also on the MCTAC plan matrix. And for any kind of escalated claims issues that you're having, she would be your point of contact to help resolve it. Additionally, we have another really great resource, which is a network trainer, Gail Parker Wright. Many of you may know her from having attended some of our orientations, but regardless of whether you're in the adult system, the children's system, whichever service you're providing, you may want to have a very individualized training for the staff in your agency to understand your services, to understand how to get prior authorization or prior notification, depending on the services that you provide, any kind of specifics regarding claim submission and payment. And so Gail Parker Wright can really assist you with that and develop a training that meets your specific training needs. And then moving on to utilization management, that's really the contact for service prior notification and authorization. So if you are in network, there are two ways that you could do that: through an electronic request through our PAN system, and that's the address for that. And just to let you know, Gail Parker Wright can give you a training specifically on the PAN system as well as if you're an in-network provider, you can submit prior notification or authorization through a telephone system. If you are out of network, that means you're not contracted with United Healthcare, you are required to get prior authorization for all services, and you do that by calling UHC to initiate a single case agreement to ensure that there's no interruption to claims payment. We also have a quality department where you would be reporting your Sentinel events. Now, a question was chatted in yesterday, great question, chatted in yesterday during our panel. Why would a provider report a Sentinel event to their managed care plan? Well, we investigate Sentinel events. So if a member, your client, has an incident, maybe an overdose or something like that, shortly after they are discharged from inpatient care, that is something that we would want to know so that we can investigate. It's also a way for us to track whether there are facility trends, whether there are program trends that we would want to look into. So I know you're all really used to reporting Sentinel events and other incidents to the state, but we also really, and it's in your contract, to report Sentinel events to the health plan. Another question that always comes up is around our behavioral health case management. United Healthcare may provide BH case management services for members who are not enrolled in health homes or ACT services. And we've got licensed behavioral health case manager that can provide telephonic support and can meet members and family members in the community. However, right now we are still not doing in-person visits. They're currently suspended due to COVID protocol. So we are doing the majority of our case management support through the telephone. And then the government liaison, the government relations team, where I sit. That's where you would send some of your innovative project ideas and collaborative initiatives that you have in your minds. Issues not identified as covered by other functional areas, as well as escalated issues. So again, if you are saying, I'm not hearing from my provider relations person, from my network manager, I am not getting a claims issue resolved, I'm not hearing back, I'm just really, hit a wall in terms of communication, absolutely, you can reach out to us, and my contact information is at the end of this presentation so that you can use that, as well as all the people who sit on the government relations team. We are on the MCTAC plan matrix. Next slide. So similar to the graphic that Caitlin showed, we divide our regions, our territory assignment, by regions that are consistent with what we see throughout the state. And this is just a visual representation of who covers what. But on the next slide, if you could turn, Caitlin, are the specifics where we let you know the name, the contact information, the covered territories, and the types of facilities and agencies and groups that they cover. Our recommendation is always to email first. It creates a paper trail. It's also much easier for people to be able to see and respond. We believe a reasonable expectation is that you should hear back from any of your network managers within 48 hours. But I do have to say, you know, we're all human and things fall between the cracks. But that is a reasonable expectation. And if you're consistently just not hearing from your network manager, please escalate it to one of us on the government relations team. I do want to point out right now that Kings, Queens, and Richmond, Staten Island are currently being covered as our network manager actually just left this past Monday. And we're actively recruiting for her replacement, but that is being covered. So if you did send an email and inquiry to Mary Beth Carney in the past couple of weeks and have not heard back, we do really suggest that you send it again to Karen Mober Coffin. Here's her information right here. At the bottom of the screen, you'll also see a general email box and phone number. But again, we do recommend that you look at the covered territories, you identify where your agency fits in and who the contact person is. Next slide. And then finally, I just want to give you a couple of online resources. At UHC, we have a lot of really great resources, but I just wanted to highlight two. The first is uhcprovider.com, where you can check member eligibility, check the status of a claims payment, submission and payment, claims reconsideration, EDI information. It's also where you can link to Rally, which is our provider directory. And there's a whole bunch of tools and resources.com as well. Call your attention also to providerexpress.com. We have a New York page that's dedicated to all things New York. And has information for New York Medicaid providers who are serving adults and for those who are serving children under 21, including a sub-tab for our 29I healthcare facility /VSCAs. There are specific resources for that cohort of providers. I definitely want to encourage everyone to check out our quick reference guides. They are chock full of really good information. We try to pack a lot of really good information into these QRGs. There's one for adults, there's one for children under 21, one for 29I healthcare facilities /VFCAs. And it's really talks you through who to call, how to get authorization. We even walk you through the phone tree. We tell you what prompts, what you should press, what you should be ready to answer, because we know that navigating these phone trees is difficult. So we try to really make it a useful QRG. We've also posted our clinical guidelines and policies, our PAN, prior authorization notification behavioral health guide. So that is kind of a guide that quickly shows you how to utilize the PAN portal. But again, if you are having trouble with that, please contact Gail Parker Wright. She could set up a specific training for your agency so that we can walk you through the process. Additionally, on Provider Express New York page, we've got the training and resources, including all our provider notifications, as well as finally that Sentinel events reporting form, so that easily you can access that and know what is a Sentinel event and how to report it. And that's it for me. Passing it back to you guys. Thank you.
Thank you so much, Alana and United Healthcare. And now I am going to, in just a moment, pass it over to Boris. I just wanted to let everyone know that we're going to spend the next second half of this webinar with your questions and facilitating this Q&A period. So Boris will be our moderator. I'm turning it over to Boris.
Great. Thank you, Caitlin. And thank you to all of our panelists for their overview and presentation. And as I was looking at WebEx struggling to change slides, it turns out even WebEx towards the end of the day slows down. So that's my interpretation of what's happening at 4:18 p.m. During, in the afternoon, late afternoon hours. But thank you, everybody. So yeah, I see the chat really being active, and I appreciate it. And I would encourage people to continue chatting in questions and comments. It's really helpful. I'm also glad to see that it seems like folks are getting really live help right here during the presentation directly from our plan representatives. So I'm glad that that's happening as well. And hopefully we can continue that support. And also, when I saw Lonnie chatted out his phone number, the only thing occurred to me is like, wow, that's a brave person. But I know all of our plan representatives have their information listed. And again, just reminding, we are recording this. This will be available and the slides. So all of that contact information and links and so forth will be coming along with that. So really focusing now on the questions and more questions that are coming in. We get these common questions, so we wanted to kind of go through those first. I also wanted to thank individuals who submitted questions through our survey that we did prior to this. So we'll definitely address those as well. And of course, we've been getting questions and comments through our chat, and we'll handle those. I think the first question that we have here on the comment, I think the plans did a really good job really going through the difference between care management, contract staff, and government relations, in detail. So I'm going to put that on hold for now. And if we have time, we'll come back to it. But I think there was a lot of information during their presentation. And I want to make sure, being mindful of time, that we get to some of the other things here. So I'll kick off with really starting with, what are some of the creative solutions and suggestions that our panelists can propose for the providers and participants today in regards to implementing and troubleshooting member access issues and barriers. And this is more in specific, when you as a provider are trying to get services for the patients or the members of the plans, and you're having trouble in getting services, what would be some suggestions the plans will have? And also, again, if you're having hard time providing access to individuals you serve, what would be, kind of some of the suggestions and solutions maybe a plan can have. So I think I'll just maybe call in folks and we'll go in no particular order. Lanya, maybe we'll start with you on this one, and then we'll move to other plans. Any thoughts on this question?
Yeah, I think sometimes, we have to think outside of the box, and whether it be, we're looking at provider services or we're looking at the call center. Sometimes if you have a member in need that you feel like needs services because there is an access issue or a barrier, make sure that we, carry that conversation up to clinical. I think, we have great teams that are able to work with providers to make sure that if there is something going on, that member can receive some type of care. While there is that barrier, and whether it be case management, it may be different type of respite services, it could be outpatient services, it could be going to one level of care before going to ACT. There's many things that we can do that are outside of the box that, could help with the barriers. Just a thought.
Yeah, excellent. Thank you for that, Lenny. Cheryl, let's go to you next.
Sure. So I don't know if I really have creative solutions or not, but I think you guys, providers, just be sure to communicate with us as often as you need to. We need to know what assistance you need and how and when we can help. So for example, if you are full, and again, I think I've said that a couple of times already, if you have some of your services or modalities that are full and you're not accepting patients, we need to know that. And part of the reason that we need to know it is so that we can try to identify trends of services or services in certain areas that are not available. That may, trigger us to monitor our network even on a larger scale. So if you don't communicate that information to us, we're really not aware that there's a problem or something that's trending to become a problem. And then the other thing is as many times as I said, please let us know if your practice is full. When you have specialized services, please let us know for sure when you have availability, because we may be, looking to call you and get a member or client in as quickly as possible. And knowing that you have that availability would be a great asset to help members get those services.
Excellent. Thank you, Cheryl, for that. I think we'll go to Ilana next.
Thank you. So to paraphrase Cheryl from yesterday's panel, we don't know what we don't know. And I think that, you know, as much as this is a bi-directional kind of relationship. And oftentimes I attend state meetings and RPCs and I hear anecdotal information that providers are really having difficulty accessing care, especially I'm hearing that in the children's world. And I come back to our team, our CM team, our network, and I'm saying, are you guys hearing this? And they say no. And so we need to hear from you guys. You know, the first step I would say is go on Rally, our provider directory, and try to do a search for an in-network provider. Oftentimes we kind of know a couple of providers and those are our go-to because we feel comfortable with them, but they're not accepting anybody new because of wait lists, or we're just not aware of other providers who are in the area. And I think that going to the provider directory and looking up all the in-network providers in a reasonable geography of where the member is a good first step. And now if you are finding that there are none, or they have, you know, really difficult wait lists, challenging wait lists, call your network manager, let that person know, as Cheryl said, so that we can see, oh, wow, we're really having an issue in this area. We need to go looking. We need to let the state know that providers don't have resources in that area. There may be a couple of paths that we have to follow, but we definitely don't know just because we exist. We know because of the information that comes our way. And so if that's happening to you, let your provider, your network manager know at United Healthcare so that we can assist you to find somebody in the area or escalate the issue as appropriate.
Excellent. Thank you. And Ashley? I think you're on mute, Ashley. Sorry.
That's always happening to me.
Yeah, that double mute. That double mute. Yes.
As I was trying to say, I would have to agree with everyone on the panel, you know, especially with Lana. We don't know what we don't know. So the first thing is key is the communication, letting your account manager know that you have reached a barrier, you have challenges, and you need some assistance. And 9 times out of 10, if I'm receiving an inquiry from a provider and I don't have that answers, but I know who to reach out to, half the battle is already won. We're putting you in contact with the appropriate entity, and then from there on, you guys are working to find a resolution. So I think everyone had a great answer for this one.
Excellent, thank you. Probably stay with you, Ashley, in our next question, which is more around telehealth and expectations of, you know, HealthFirst, but of course all the panelists today and the plans we have. And just to underscore, when we talk about telehealth, because there's so much there, right, and everything that Caitlin went through, but specifically around access and what are expectations from the plans that are represented today when it comes to telehealth, putting aside all the emergency stuff and waivers, but in general, what is your expectations?
Well, the first thing is to, you know, be notified that you are a provider who wants to render these telehealth services, and thereafter working with you to make sure that you're aware of how to bill for these services. And then after that, it's, you know, we're just communicating, we're making sure that it's a standard workflow. All of the providers are in the know about what's going on. So I would have to say the expectation is being notified that that's something that you're wanting to do, or the services that you're wanting to render, walking you through the expectations of billing, what that's going to look like, and then rendering the services to the members who are going to get that care.
Excellent. Thank you. Ilana, let's go to you next.
Sure, yeah, I think Ashley said it right. You know, let us know that this is a service that you're doing. Again, in steady state, not under the emergency commissioners and the waivers and the flexibilities. You know, if this is something that you're doing under steady state as we move forward, let us know. We could assist you to make sure that you are ready to submit a claim so that there is no interruption to your claims payment. And, you know, connect with us if you're having issues. One of the things that one of the panelists yesterday, who's not on today, said So I'll say on her behalf, like, you know, the state please everybody go listen to the MCTAC forums on this issue, because don't take our word for it. Go hear it directly from OMH and OASIS. But one of the things that they did say is that every agency has to provide what the member needs. So, you know, if somebody is requesting to see you in person and you're only doing telehealth, you're only doing virtual visits, that's a conversation to be had. It has to be what is best clinically for that individual. And again, we're all waiting, we're all on the same page, waiting for the state, the O offices to come out with official guidance, post executive or governor's executive orders. And once we all get that, that's the new playing field. And so we'll all be starting at a level playing field moving forward, and looking forward to things operating smoothly.
Excellent, thank you. And Cheryl?
Sure, and so I just wanted to visit telehealth a little bit differently, but yes, we're waiting for guidance from the state on post-pandemic, but everything is status quo for now, so just continue to bill as you're billing. And please know that telehealth itself does not require authorization. So rendering a service via telehealth does not make that service require authorization. So if it's an office visit that you're rendering via telehealth, authorization would not normally be required for that office visit, so telehealth would not make it require authorization. However, if you have services such as partial hospital, ACT, PROS, etc., those base services would require authorization most of the time. So, you know, if you're rendering some of those services via telehealth, then of course they would continue to require authorization. So again, it's, you know, what's clinically best and medically necessary for your patients, as you know, whether they're seen via telehealth or inpatient. I'm sorry, or in person. And again, that's a decision between you and your clients. And the other thing that we're going to be asking, and you may get that from when our provider relations staff outreaches to you for any reason, is asking you what your back to office plan is, and whether you're expecting to just do telehealth or do 75% telehealth or do some hybrid version of telehealth and in-person, depending on the patient's needs and the provider setup situation.
Excellent, thank you.
You're
So
welcome.
before we move to the next question, so just to some of the things to summarize. One is, as throughout your presentation and answering these questions, the key is communication, right? Make sure that folks are communicating with you. That's number one. And two, what I'm also hearing is they can also use you as resources, right? So if they're trying to make referrals and they're struggling with helping their patients, you know, and can't find somebody, you know, they should pick up the phone and call somebody, right? And you have all these contacts and information. One, that's also part of communications, because you might not know what's happening. And two, you might assist them with, maybe there's other providers or other services that could also help the individuals they're trying to help. So as we always have said in all of our presentations when it comes to managed care, yes, you're a payer. Yes, we talk a lot about claims and not getting paid or issues and so forth. But at the same time, it also should be seen as a partnership and trying to work together. And as like with any partnership, communication is the key, but also, you know, folks can, you know, lean on you when they're struggling as well with certain things. You know, clearly to an extent that you guys can help, right? Because there's also state involvement and rules and regulations you have to follow that are dictated by the state. So I really appreciate that. I also see a lot of questions and that are very detailed and specific, which is great, and keep them coming. But a lot of them, the way I'm kind of saying, is more about, I can't find this, or I need more information on that, and so forth. So I really hope that, again, the matrix that we have out there, the folks utilize would be helpful. The information that our plans have provided today might help a little bit in some areas. And I think, again, at the end, when everything fails and you still can't navigate, as everybody, all of our panelists said, I would invite folks to really reach out to those escalated numbers and people. And more I see our panelists providing their information for people to reach out to them directly. So please take advantage of that as well. So I wanted to kind of make sure, because I know we got a number of those questions in regards to how do I get to folks. One consistent question we also got in the survey and in the chat, and I think a couple of plans answered this, what should the provider be expecting as a turnaround time from a representative back to them, right? So I'm a provider, I contacted somebody, should I be expecting 24 hours, 48? Is there like an expectation on how fast people should return my call or return my email? And I did hear in some of the presentations, I think a mention of 48 hours, but I just want to open it up and maybe, and again, I think Ilana, you talked about, you're also people, right? Things happen. And I think taking that in account, but just, are there any thoughts or expectations you guys can provide? Because I know we get a lot of like, how long should I wait before I call somebody else, right? Because I also don't want to wait an hour and say, nobody called me, which is what my kids do when they chat me or text me. I'm supposed to respond within 3 seconds, but maybe a little bit more realistic here. So I don't know if anybody wants to jump in and kick this conversation going.
Hi, Boris. Yeah, I'll answer that. So for HealthFirst, generally the rule of thumb is 48 hours. Whether it's a call or an email address, if you don't hear from us within 24 to 48 hours, I just recommend, doing one follow-up email and seeing if you can get a response. Thereafter, we have an escalation process. You're going to want to make sure you loop in Maurice White so that way he can get involved and kind of just see what's going on and get you in contact with the right person, and then also address the concerns that you're reaching out to us for.
Excellent. Thank you. Others?
So this is Cheryl Foley from Beacon. So I did see Diane chatted that question in as well. So I'm kind of thinking that was directed at me.
I'm not pointing fingers. I'm not...
No, it could be. So then that's fine. So again, everybody's saying 48 hours, but definitely think of it as 48 business hours. Because if you send me something on a Friday night or Friday evening, probably not till Monday. I've been accused of working weekends before, but not as often, as I don't like to do it. But anyway, so yeah, it's usually 48 business hours. And if you had sent me something, truly as an escalated item, and I have not responded to you within 48 hours, please feel free to shoot me another email, because, after 48 hours, it goes, pretty far down. So shoot it again, so it's at the top of my pile.
Great. Thank you for that. Lani or Ilana, anything different?
I would just say the same thing, just really, if you're not getting an answer and you feel like you're not getting a reply, I'm a glutton for punishment. I think a lot of people know that. I can definitely start some fires if need be, so always include me if you like. And like everyone else, I am human. We do get a lot of emails, but just that I'm an advocate, because I think questions should be answered and your life should be made as easy as possible, because sometimes on the provider side, we all know it's a hard run sometimes. So go ahead, put me on there, and I'll see if I can kind of get it to where it needs to go and get you an answer. But 48 hours typically, yeah.
Great, thank you. And
I just want to add, don't forget to call us back within 48 hours. So when we reach out to you, remember, it's two-way street. So yes, 100%, we have to be held accountable. And there are a million excuses, but there are no excuses. We need to be held accountable. But on the other hand, oftentimes we do reach out to providers, respond to providers, send out initial inquiries to providers, and don't hear back. So we would love to make that commitment to you and hear that commitment back from you guys.
Yeah, no, thank you. And just wanted to highlight that, what Ashley said, like, and again, realizing that things happen, right? And so if you don't get a response in 48 hours, this is just my recommendation, and I just want to highlight, I also recommend people try one more time, right? Give somebody a chance. And, and of course, if they don't respond again, then that I think it's definitely reasonable to escalate. Now, if it's more of an emergency or anything else, that's a different situation. Or, of course, also if it's more of a systemic issue, right? Every time you reach out, you don't get 48 hours, and every time you have to do 2 or 3 times, that, I think definitely the folks on the panel today would want to know that. If it's more of a systemic issue that it's consistently happening versus, it just happens once in a while. I think that's also to kind of throw out there is reasonable. So no, thank you for that. Appreciate. I know we get a lot of that piece, and Ilana, I totally agree. I think the same should apply to the providers to get back to you guys, right? Because I think it's only fair from that perspective. I also know we have Yvette, one of our colleagues on the MICTEC side, is on the phone today as well. Want to see if you have any things that you have noted from the questions that have been coming in. And I know you've been monitoring the chat as well. So just want to have an opportunity just to make sure if I'm missing any questions.
Yeah, I think the only question that you didn't come across was there was a question around, and maybe they could talk just a little bit more about this, about the Sentinel events and where you can find documentation related to that, so folks know what is expected in terms of reporting. So I think that was really the only thing that I've seen so far that hasn't really been, answered or addressed.
Since I brought it up, I'll shoot the UHC link. I can't speak for the other plans, but I'm happy to put it in the chat for whoever it is that asked the question. I apologize, I missed it, and I will put it in the chat so that you have a link.
Okay, thank you. And I think other plans have either in the matrix or hopefully through this presentation that information as well. I know we just got a question in regards to, when plans communicate, sometimes they send the wrong information. So I think that one is hard to figure out, right? Because there's going to be a lot of situations. So one, it could be stemming from the plans just don't have information, the correct information, because things also change with providers, right? And I think all of you during your presentation said how it's important for providers to update all of the information, where things should go and so forth. But I'll speak for you guys and you jump in. But if as a provider, I updated all of my information and I keep it up to date, and somehow you keep sending emails still to the wrong email address, even though I updated the right forms, credentialing and everything, I would assume you would want to hear it, and it should get, somebody should reach out to provider relations or somebody else saying, hey, I'm still getting this to the wrong address. Right? I mean, would that be the process? I mean, first, I think providers should make sure you have the right information, because one of the reasons you might be sending it to the wrong address is because you just have that. But then, of course, I just wanted to, because I know we got that, wanted to make sure, would that be accurate in the process? I don't know if anybody wants to jump in and talk about that a little bit.
Hi, Boris. I'll go first again. I would say just to piggyback off of what you said, a lot of the times we ourselves may not have the appropriate contact information. I know plenty of times, staff changes do happen. But again, going back to communication, just as we would expect you to tell us, or the providers to tell us, hey, my phone number has changed to the agency, my tax ID number, our name has changed, we would appreciate just being given the appropriate contact information, and sometimes maybe 1 or 2 people. Just as if I were emailing you and you do billing, but I need to get in contact with someone for credentialing, I would expect to have that information shared with me as well.
Excellent. Thank you for that. We're also getting a number of questions about utilization management, authorization, claims, and so forth. And some of them are very specific. And again, since we have plans here, they'll get this information, and hopefully you guys can reach out to folks who are today, or the contacts that have been provided. But I think the key here, I just want to go back to each plan and what they said, because we can't really, during this type of event, address all very specific details that folks are submitting. But in general, I think if you're not getting responses, or or you're getting things like there was a comment about voided authorizations that go backwards, or claims not being processed, or anything of that nature, I think the key here is really reaching out and escalating things when things are not being worked out, right? So like, Lonnie had specific context. For example, he went through for claims versus contracting. Everybody else had similar kind of context. We have that on Matrix. So again, I would encourage folks to really try to not just go through provider relations or other types. If that's helpful and that's working, that's great, because I think that's how it's supposed to work. But if that's not working out, you should definitely escalate that. Because I know we got a couple of questions. I don't know, and I know our panelists do see the chats coming through, so I don't know if anybody wanted to say anything else or address anything specific to that.
So this is Cheryl from Beacon. So I did see a question chatted in about what the best way is to address cases when you receive your authorization, and then it could be a couple weeks or months later, and the eligibility is retro terminated. So that is an issue we all face, and we rely on the sharing of eligibility files from the state to the plans. So if membership is or if a member's eligibility is retro terminated, unfortunately, there's nothing that we can do about it from the plan side of things. And it just, I hate to say it, but it's the nature of the beast, and we have to go by the eligibility files. And I do believe that typically with Medicaid, you can, if a member has been retro terminated, we can go back 2 years to recoup any funds that were paid on those claims. So just, to let you know that we are held to the eligibility files from the state and the plans.
Great, thank you for that. Yes, no, that was very helpful.
I was just going to say, Boris, that there's been so much going on, and there's going to be so much more going on within, new services and AVA coming down the pipe, and you had everything else. So I think, really kind of if there's an opportunity to claims test with the MCOs also, and this is just a blanket statement, making sure we get those claims in a timely manner, protecting your rights as a provider to get them in within the 90 days, and also look at appeal. And if there's something that happens, I know that we've done many different projects to address any claims issues, any modifier issues, reprocessing of claims. So really try to stay on top of the A&R. I know it's a beast, but really, we're here to partner and just as much as we've had to process on our side of configuring all the systems, you guys had to do that as well. So, stay on top of that, be vigilant, and call if there's questions, or if you see your first 10 claims denied for one service, let's look at it. That's all I can add.
No, I appreciate it. And I know, this is not specific to claims, but I think that your comment about claim testing is just important. And, and sometimes folks feel like it's only like in the beginning of something, right? You do claim testing when something new starts, or I'm a new provider. But I just want to underscore, and I know I've done it when I was in the provider world, when you find out something is not working or you're getting denials, as kind of Lani, your example here, you might actually do test claiming in the middle of your relationship or your partnership, right? Just to find out what's going on. So claim testing is big in the beginning, meaning when your program starts services or you provide it within a plan, but also it could be 5 years into it and you've been an old provider with a plan, but something has happened and you might need to do claim testing just to get back on track. So I just wanted to underscore that point. So thank you for that. Want to see if there's any other questions that has come in, again, Yvette or others, before we move up to also realizing we're approaching that hour, the time of the day.
Yeah, Boris, I don't see any more questions coming in. So again, as you mentioned, for folks, if you have any questions, please feel free to submit them. But right now, I think we've pretty much addressed all of the ones that have come in so far. And again, thank you to the panelists for actually providing some live responses to our participants. It's been very helpful.
Excellent, thank you. So Caitlin, maybe we can for now we have a couple more slides, and if additional questions come in, we can definitely address those as well. But
yes, I will pull up a slide. All right, so first I just want to echo a thank you to all of our panelists. Thank you so much for volunteering to be part of these panels and for your quick answers in the chat as well as live on today's webinar. So thank you all so much. Everyone can see on this page the panelist contact information. So here is the email for each of our planned panelists today. As a number of them mentioned, email is a great way to start because there's a paper trail. So that's always an option. So you can see all of their contact information there. You can also see it on the plan matrix, which is linked here. But if you don't want to wait until you get the slides, you can go to matrix.ctacny.org. It's in the chat, so you can access it before the slides come out. But this is our panelist contact information. And then we just wanted to remind everyone that we've updated our site, but it is still the same URL. You still go to ctacny.org to access all of our tools, all of our resources, all of our trainings. So that is still available, still a great resource. We've just given it a spruce and added some new features. So we will be posting these slides and recording on that website. Most likely it will be on Monday. So please do look out for that.
Okay, thank you. So one of the things I actually just wanted to highlight, and this is not to pick on Lani or Blue Cross, but it seems like there might be a little bit of confusion with the name Blue Cross, because I know in New York State, we have at least 2 Blue Crosses, if I'm not mistaken. And then there's the whole AmeriGroup and so forth. So I know, so one I just wanted to highlight, and I know through the chat, I know Caitlin, and I think Lani, you did, one, for folks to be very careful when you are looking contact information on the matrix, make sure, you know, if you're looking for Blue Cross in New York City, it should not say Blue Cross of Western New York, because that's more about Buffalo and so forth. So I just wanted to highlight that piece. I don't know, Lani, if you have any other, you know, tricks of a trade to figure out how to distinguish your organization from other AmeriGroup Blue Cross's versions.
Yeah, no, I was just going to put in the chat to look for the Health Plus. That's usually the key for us. If you see Empire, Blue Cross, Blue Shield, Health Plus, I'm your guy.
Got it. Got it. And if anything like Empire or AmeriGroup, you're probably not, right?
If not, I can direct you to the right place. Again, Western New York, I can get you there as well.
Gotcha. Gotcha. All right. Thank you. And I know sometimes it's a little confusing for folks, and you know, especially, you know, if you're doing something quickly and you're looking online, you might be looking actually at the wrong plan and not getting to the right people. So I appreciate that. Thank you. All right. Anything else before we close off? Just want to make sure we covered that. Again, thank you everybody for your, you know, presentation and participation, to our plan partners and panelists today, and definitely to our participants as well for all the questions and the conversation. All right. So I don't see any additional questions. Again, thank you everybody for sticking out with us till 4:51, and I hope you have the rest a good evening. And thanks again. Take care, everybody.
Take care.
Take care, everyone.
Take care. Bye-bye.